Hi there, my name is Theresa Moen. I am a second year doctoral student in speech and hearing science here at Arizona State, and I am very excited to provide this lecture for you today. A big thank you to Dr. Patton for this opportunity. So I'm going to share my screen here and we can get started. Right. So this lecture today is called Bilingualism and Culture in Communication Disorders. Like I said, I'm Theresa Moen. I am a bilingual speech-language pathologist as well as a student. And just a little bit about my background, I majored in communication sciences and disorders and Spanish at Illinois State and graduated there in 2016. Then went on for my master's in speech-language pathology at Marquette in Wisconsin. And I got my bilingual specialization there as well. And from there, I worked in the schools as a bilingual SLP, working with kids preschool through 5th grade. And I worked there for 3 different districts for 3 years. And I really enjoyed it, but I felt like there was some missing information, missing research in the area of bilingual assessment and intervention. So I saw randomly an ad for the PRIDE program, which is a grant program here for doctoral students focusing on intervention research for multilingual children. So when I saw that, I thought it was meant to be, and I started my PhD journey last year. So that kind of is, in a nutshell, what brought me to where I am. So today for our lecture, we're going to talk about culture and language and bilingualism. Then we're going to ease into some clinical issues and assessment and intervention. And to finish off, I want to talk a little bit about language policies. And as we're talking about these things, I really want to keep a real world lens on everything and how these topics can come into play as an SLP or an audiologist in our field. So to start, I want to give you this statistic. 8% of school-based SLPs said they felt very qualified to address cultural and linguistic influences on service delivery and outcomes. So this is from the ASHA School Survey back in 2016. And so I know this was a little bit dated, but it's still very glaring that 92% of SLPs didn't feel qualified, didn't feel competent in addressing culturally and linguistically diverse factors in their patients. So there's definitely a need for this knowledge on multilingualism and multiculturalism. And so it's a really important topic. A few other statistics I want to throw at you specific to Arizona. One is about Arizona school-age children, ages 5 to 17, that about 29% in 2017 spoke a language other than English in the home. And then 41% of young Arizona children have a parent, at least one parent speaking another language in the home. So there are quite a few bilingual children in Arizona, as well as adults. Since I was a school-based SLP, so my background is primarily in children, but I also have some experience with adults as well. So I'll try and trickle that in as we go. So what happens when there is a mismatch in language, culture, dialect, and/or socialization practices between a clinician and a client? Well, a few things can happen. So an issue that I've seen firsthand in the schools had to do with identification, whether that is over-identification or under-identification of disabilities. So oftentimes in the schools, we are trying to determine whether a bilingual child has a language disorder, a speech and language disorder, or not. And so this population of children, they can be over-identified because if the individual completing the evaluation doesn't consider the child's language history, cultural background, dialect, all of those things, then a typically developing bilingual child could appear to be disordered. They might present like they have a language disorder in the language of assessment, but that's not the case. So that leads to some over-identification. But on the other hand, children who speak another language and are learning English can be under-identified if the practitioner takes more of a wait and see approach, or if they assume that the difficulties that the child is having in English is just due to the fact that they're an English language learner. So in that case, sometimes kids fall through the cracks and are under-identified with speech and language difficulties. And that being said, too, the other factor that can come into play is inappropriate treatment. So maybe we do accurately assess a child, but then once treatment comes into play, how are we appropriately providing those services in a culturally responsive way. So to start off, culture and language. I want to ask, what is culture? And I know I can't hear your answers, but I want you to think to yourself, what comes to your mind when you hear the word culture? Give yourself a second. What do you think of? Maybe you think about your own customs, your own traditions that you have as a person, or your family or your community. I'm curious, what makes your own personal culture unique? I'm sure all of you have very, very different backgrounds, very different communities. So we each are very unique in the culture that we are brought up in. And according to Ferraro, everything people have, think, and do as a member of society can be considered culture. And some things to remember about culture is that it's dynamic. So it's ever changing. It ebbs and flows throughout a person's life. It's learned and it's also shared. It's part of a community. And so leading that into language, we ask, what does that have to do with language, right? What's the connection between culture and language? Well, as clinicians treating patients, cultural factors are very, very important with the treatment of the patients, the assessment, and the language. So, for example, there could be cultural differences in communication style. Maybe the communication itself, how if it's indirect or if it's direct style of communication, context, what you actually are talking about, that's directly related to someone's culture. Also, you have factors like, for example, an independent culture versus an interdependent culture. Maybe it's more of we are all as one, we're working together for a common goal, versus independence is really valued in that culture. So all these are just a few small examples, and there are many, many cultural differences that we can go into. But something I've encountered in my experience in public schools, I found that sometimes with communication styles, parents differ depending on different cultures. So some parents were very comfortable being vocal and sharing information and acting as an equal member of the special education team when we would have meetings, things like that. Whereas other parents weren't as comfortable with that. They more referred to the professionals developing educational plans, and they didn't feel as comfortable being very direct with their communication. So that's just one small example, but there's so many small factors that make up one's culture and can influence how people act and speak. So that leads us into socialization and language. So these are some different examples of how socialization factors are intertwined with language. So the language of social interactions, the people in those social interactions, and even the objects of interactions themselves are just a few ways that language can vary based on socialization practices. So, for example, in some cultures, children are considered equal communication partners, right? So they are expected to turn take, kind of have that back and forth. Whereas in other cultures, children may be expected to be more a passive observer of a communication exchange. They're expected to more listen and observe versus be an equal partner in the communication. So it's really important to consider this when evaluating and treating children from different cultures. For example, oftentimes we might encourage parents to join in play, right? If we're treating a child that's only 2 or 3, we might say, okay, mom and dad, come to the floor. We're gonna play all together to work on speech and language. But we shouldn't assume this is a typical or natural exchange, because depending on the culture, this might be a very strange scenario to complete. So a parent might not feel comfortable joining you and their child on the floor, for example. That's, again, one example, but you can see how you're socialized, how you're brought up, it goes hand in hand with language. And just as we need to consider these socialization differences, we also have to consider contextual factors, especially when we're looking at children and adults. So we have socioeconomic status, thinking about language minority versus majority. So in the US, and again, this varies depending on what part of the US you're in, but generally the majority language tends to be English, and then a minority language would be a language other than English. We need to consider the amount of input the child or adult is getting or has received in both their languages, the quality of that input. Was it very academic? Was it more casual, conversational? And then we also have to think about the age that the person acquired their second language, and also differences between the two languages, because that's going to really inform how we assess and treat the people we're trying to treat. So I want to give, again, try and get into real world and real life examples. I want us to imagine that we have a 6-year-old student who moved to the US, let's say from Mexico, and his native language is Spanish, and maybe he's struggling in class, and so he's referred for speech and language evaluation. And so looking just with only that information, if I were to only look at his abilities in English and not examine any of these contextual and socializing factors, I will not be able to assess him accurately. I need to know what kind of language input he was getting in Mexico and what he gets now, how much English and Spanish he uses on a daily basis, and with whom he uses those languages. I need to know if the difficulties he's showing in English are also there in Spanish, because if they're not, then that's not a disorder. And so also I can't use a standardized test with that child that's normed on monolingual children. I can use a standardized test that's normed on bilingual children, but if all I have is a test that was used with only English speaking children, then those results are not going to be valid, because they're not going to show his true abilities. So that's just one small case study of what could go into assessing a child. So just to wrap up about culture and language, I want to touch on a few universal principles. So first, language transmits cultural values. The values of someone's culture are reflected in their language and their behavior. We each are very unique, and how we speak, how we act, that goes hand in hand with our culture. Second, there's variation within cultures. So two people from the same culture are still may differ. We can't assume that certain characteristics are going to be with this family because they're from the same culture as that family. Within culture, there's variation. And then lastly, language milestones are universal. They're the same for all cultures, across languages, across countries. So babies typically start talking around 1, and then they start combining words around 2, and so on and so forth. There are universal milestones that they all meet. That kind of segues us into bilingualism itself. And I want to provide you with this quote. I love quotes, and I really appreciate this one. It's a bilingual environment is most often a necessity, not a choice. All right, so I want you to take a second and let that sink in. If we were in person, I would ask, how many of you are bilingual, and kind of get to know each of you a little bit better if I can. But for those of you who are bilingual, I ask, like, was that a choice? Did you elect to learn that language, or was it a necessity? Was it circumstantial, part of just the day-to-day, what you needed, that your environment and your circumstances, you had to become bilingual. So something to think about, that it's not always a choice that people become bilingual. It's a necessity. It's needed for day-to-day. So there are 2 general types of bilingualism. We have simultaneous language acquisition, which basically means that you acquire both languages simultaneously, and then sequential. So you learned one language, your L1, and then your L2 or your second language later on, whether that's an early sequential, which would be like after age 3 or 4, or a late sequential, which is after puberty. So like it could also be called an adult second language learner, or adult second language acquisition. And just as I was talking about with our quote, we have circumstantial versus elective. So sometimes bilingualism is circumstantial. The circumstances of someone's life, or wherever they are, if you as a child had to move to Russia for some reason, maybe your parent got a job, I don't know, you would need to learn Russian in that country to function in day-to-day life. Whereas maybe as an adult, you decide to take up Italian, that's more an elective bilingualism, that you chose to add another language. Then there are also 2 kind of differing definitions of bilingualism. There's broad and narrow. So a broad definition of bilingualism would consider maybe if someone has a few words in a different language, that would designate them as bilingual. Whereas if you have a narrow definition of bilingualism, the person would need a minimum level of fluency. So this is where, and we'll get into this a little bit more too, bilingualism, there's quite a spectrum. There's quite a continuum of being bilingual. So those are just 2 different opinions of how to define if someone is bilingual or not. So with simultaneous bilingual acquisition, children who learn 2 languages or more at the same time, we want to consider all of these different things that can come to be when you're learning 2 languages. So mixing of languages is very typical in early stages. Your children are learning both, or multiple. So they're mixing languages. They might be code switching, which if you're not familiar with code switching, Basically, you're using both languages within a sentence or within an exchange to better explain your thoughts or express yourself. An example might be vamos al parque, or vamos a comer macaroni and cheese, something like that. And then for these children, these children, they have two separate phonological systems, so different sounds in each of those systems. And then what's important to note, again, they have the same language milestones as a monolingual child would have. So that's key to note. Now, on the other end, we have sequential language acquisition, or second language acquisition. And with second language acquisition, there are typically 5 stages a person goes through. The first, not all people go through the stage, but there might be a nonverbal or silent period. So communication is more through gestures than use of language. Then we have the early language stage, which is telegraphic and formulaic language. Telegraphic meaning single words like juice. Formulaic meaning almost, if you think of phrases like what's this, don't know, look at, something like that. And then production with errors is the next stage. So language is ungrammatical, there's disfluencies and fillers. Then we have fluent with errors, so consistent errors, but not many different types. They might still have an accent. Fluent without errors, so native-like proficiency, they may still have an accent, but that's not an error. And they have age-appropriate errors. So just a few stages to think about, and think how important it is for SLPs and teachers to understand these stages. You know, imagine completing a language assessment with a child in the early language stage of English acquisition. They might present as disordered, but that is not the case. So something to think about. So some bilingual effects on language development. As a second language increases in use, the first language is affected. So this is for children and adults who are learning a second language sequentially. So we have language transfer. Language transfer occurs when characteristics of one language affects the other. And this could be positive or negative. So a negative example would be it raining. So, and these are examples for Spanish and English. So in Spanish, you would say está lloviendo, right? It is raining. But you only use está, so that a child might make the error and say it raining when they mean, you know, it is raining. So that's a negative transfer. It looks like an error, but it's really just their Spanish is influencing or having some transfer on their English. And a positive transfer example would be the fact that both Spanish and English use complex sentences, like the word because. Because in English, porque in Spanish, they're very the same concept, that we're trying to connect and create complex sentences. Then we have nonlinear growth. So that's just saying that development and advancement of the second language doesn't always happen in a nice linear fashion, always increasing and improving. Growth can be affected by a lot of different circumstances. For example, if a child travels to their home country during summer, and they maybe have a period where their English isn't growing, like their English skills aren't growing, then when they return to school in the fall, it picks up again and their English continues to grow. So that's just what it means. It's not perfectly linear. It's most likely nonlinear. Then we also have language attrition or language loss. So if you've taken a foreign language, or you used to be more fluent than you are now, you might have heard the phrase, if you don't use it, you lose it. That kind of is true. So language attrition is when the first language atrophies, or the speaker loses some of their proficiency, and it can happen if they aren't using the language as often as before, or in as many contexts. That's something that can be affected. That's an effect that can be on language development. And then protracted development is similar to language loss. It's caused by lack of use, but it's more referring to skills not being developed in the expected timeline. So for example, if we'd expect a Spanish-speaking child to hit a certain milestone, use a certain grammatical marker at age 6, but they don't meet it until age 8 or 9 because of their sequential bilingualism, that would be an example of protracted development. It's kind of pushing those milestones a little bit out. And then finally, we have incomplete acquisition, which is very similar to the protracted development, but the skills not learned. So maybe if you've taken Spanish, I use Spanish as my example because that is the other language I speak. So the subjunctive, which is a type of mood in Spanish, maybe someone who's kind of in that incomplete acquisition, they never obtain that skill of subjunctive, for example. That might be an example of incomplete acquisition. A big picture of this whole slide is that these effects of bilingualism are not disordered. They're not signs of a disorder or atypical. These are effects that can happen just with bilingualism. And so I want to use this slide to segue us into some clinical issues. And I've mentioned this a little bit of looking at both languages and needing to understand that the difficulty has to be present in both the child's languages for there to be a disorder. So we can't consider a child to be two monolinguals in one. You know, they are bilingual. They have the skills in both, and it's very much all intertwined. So we can't take test scores and language samples from a bilingual person and compare them to those of monolingual speakers in that language. Although you will see people in the field will try to do that, but that doesn't work. That's not how it's intended to do. And also bilingualism exists on that continuum, like I've mentioned before. So at any given time, a child or an adult could be more fluent or more proficient in Spanish in some times, and then English in other times, just like we talked about a child maybe going to their home country for the summer. During that summer, they're going to be on the far end of that spectrum, but then as they come back maybe to English schooling, they'll go back on that chart. This is really important in diagnosis of communication disorders, this idea of a bilingual is not two monolinguals. We can't use scores from an English standardized test for a bilingual child because it's just not valid. And I like this quote by Dr. Bodor and Pena. They are very big names in bilingual assessment research. They say examination of both languages of bilingual children with language impairment has not been widely completed, yet it is necessary to understanding the ways that language impairments may be manifested in bilingual children. So when in doubt, we need both languages to be evaluated, which leads us to our clinical issues, assessment and intervention. So just like I was talking about, we need to look at both languages or all languages of a child. And this is just a little general slide about best practices for bilingual assessment. So we need to consider both languages, and we're looking for a converging evidence approach. So looking at all of these different, all these little bubbles make up, we need to look at all this in English and Spanish and then compare the two. So we have an interview, informal assessment, formal assessment, observation, and dynamic assessment. So an interview, and that might be in Spanish, English, it just depends. Ideally, you're interviewing the parent and understanding what languages are spoken, what are their concerns. Again, thinking about cultural differences and what is appropriate. Informal assessment might be a language sample. Formal assessment might be a standardized assessment that's been normed on bilingual children. Observation maybe in the classroom or at home. And then dynamic assessment refers to when you're trying to see if a child can do a skill given some support, some teaching. So you'll test the child. Let's say I want to know if the child can answer WH questions. So maybe I'll see if they can do it. They're not getting the concepts. I'll test, then I'll teach the concepts. I'll say, this is what this WH question means. This is where, who, what, and then I'll retest. So it's test, teach, retest to see if they're able to grow with some support, with some teaching. So this is a little bit, in a nutshell, best practices for bilingual assessment. And then with bilingual intervention, we want to encourage bilingual intervention because the culture and identity of the child comes into play. So bilingual children have the right to maintain their home languages. It's part of their culture. It's part of their identity. And learning their heritage languages promotes good family relationships. And also it's positively related to academic outcomes. And also there's more opportunity for generalization and carryover if they are receiving bilingual intervention. And parents are able to provide input in their native language that's cognitively stimulating. If you were to tell a parent to only speak in English, which is their second language, that's not going to be beneficial for the child because the child needs to be in a language-rich environment, getting the best input they can get. That's when we've talked about input, that's what we mean with giving language models and rich language environment. Also, I want to mention too that it's so important for the parents to have that opportunity to be able to help with therapy and carry over their home language. So what does ASHA say about all this? Which, if you're not familiar, it's the American Speech Language Hearing Association, which is our governing body. And so they say that all SLPs and audiologists are obligated to provide culturally and linguistically appropriate services. And thinking back to that statistic at the beginning of the lecture, only 8% of us at the time of that survey felt competent with this, but this is expected of all of us. So my question is, bilingual intervention, bilingual assessment, we know what's best, but what if we are monolingual clinicians, which is, totally, it's totally a valid thing to happen, that you're a monolingual clinician, but you need to give best practices, best culturally linguistically appropriate services. But what do you do? Because you don't have the other language. Or what if the client speaks a language that's really hard to find an interpreter or hard to come by? Basically, we either refer the child to a clinician that is bilingual and can provide those services and that assessment, which sometimes that's not possible because it might be, depending on where you are, or if there's availability, that just might not be an option. So if that's not an option, we adapt, meaning we use all the resources at our disposal. We use interpreters, like I said, or parent training, or even including siblings in the session to try and provide that culturally and linguistically appropriate assessment and services. So adapting can take a whole lot of different forms, but the main thing is that you as a monolingual clinician, you are still very, very qualified to help these kids and adults, and to assess and treat them appropriately and culturally competently. So adapting just involves using your resources, but also choosing intervention targets that'll have the most transfer between your languages. So sometimes I've seen this happen as well, that maybe the child receives a bilingual evaluation by maybe a district bilingual SLP, let's say, but then they go and receive services from monolingual SLP. You want to make sure the targets you're targeting, if you're targeting something in English, you want that goal to still carry over to their other language. So we have language specific goals and global language goals. And I could go into a lot more detail about intervention for bilingual kids and how to, talk about shared versus unshared, and how to get the most bang for your buck as a clinician. But this is just a little bit in general. So a language specific goal would be a goal that's specific to one of the child's languages. Maybe that's past tense ED in English, because that's only in English, not in Spanish, or regular plurals, or gender agreement, using la casa and el gato. We don't use gender in English. So that'd be, if you're targeting those articles, that'd be a Spanish specific goal. Same with trill R, right? We don't have that double R for like perro. We don't have that in English. So that'd be a Spanish specific goal. Then you have global language goals, which would be something that you can target and it's going to carry over into both languages. And this is especially relevant if, the child who has a language disorder, in theory, they will have global language targets because they're showing difficulties in both languages. For example, maybe they have very, very simple sentences in both languages. So we're going to want to target language complexity. And just like I talked about the transfer, right? Because, porque, you can target because in English, and that'll have good carryover into Spanish because it's that same concept. Same with narrative languages, right? Telling stories, those are global language goals. Predicting, comparing, contrasting, describing, things that as a monolingual SLP you can target and that are still appropriate for the child or adult in their other language. So this leads us to our final section here on language policies. And I wanted to focus on it just because here in Arizona, I think it's very, very relevant that we discuss it. So before we get into the actual policies, I want to talk about language proficiency and what that really means. I know we've been talking about bilingualism and that continuum. Proficiency is similar. So overall language proficiency is the ability to communicate and understand effectively within output, which is speaking and writing, and input, which is listening and reading, channels of language. And general language proficiency refers to the ability to efficiently map form into meaning in conventional and efficient ways to have meaningful conversations or communications. So that is the general idea of what language proficiency is. And that really comes into play with language policies. So here in Arizona, we're considered an English-only state. We have a law, it's an English only policy. It's called Proposition 203. It was enacted in the year 2000. And all schooling has to be completed in English. California and Massachusetts were all English only in the past, but they've since voted against these restrictions. So right now in Arizona, students who are found to be ELLs or English language learners are put on a learning track. So it's known as Sheltered English Immersion, SEI. So there are 4 different models, and I'll show them in a second. But that's part of the English language learner program. So the goal is to gain fluency in English, and maintaining the home language is really a priority. The goal is to get language strong, get the English language strong. And so within that umbrella English only law, there are 50-50 dual language programs, which are 50% Spanish, 50% English, or they might be a different language depending on where you are. But the goal is still to phase the student out of structured English immersion. So phase them out of ELL programming into English only. So if a parent really truly wants a dual language program, they either have to find a private school or complete a waiver process. And that's even if the school, assuming that the school has a dual language program. And so it's just important to think about, because we know research shows us that dual language programs are just as effective as English only. They're just as successful, but I think even more successful because they're preserving the child's home language and also encouraging biliteracy, biculturalism. So I think I'm definitely I'm more of a fan of the dual language programs. So that's on the education side, but then also society's side, we have the prescriptivist attitude that we're dealing with. So sometimes this attitude still exists today, that people think that English is the assumed official language, that even though the US doesn't have an official language, we don't. People kind of assume that you need to learn English, you should learn English to live here, attitudes like that, which are not necessarily true. So that's that attitude in society as far as language policies. And just as I was mentioning before, these are the 4 different program models for the structured English immersion. So we have pull out, which the children are pulled out for their English support. 2-hour model, they get 2 hours a day of English support. The newcomer model, which I believe is 4 hours a day. It's for children who have been in the US, I believe, less than 6 months. And then the 50-50 dual language immersion model, which it is great that they have that dual language, but like I said, kids can then exit out once they no longer qualify for the English language program. So it's a tricky situation. And unfortunately, Proposition 203, it doesn't look like it's going to be on the ballot anytime soon. There were rumors that it was going to be on the ballot in 2020, and then that didn't happen. And now I just saw an article. I was very disappointed that it's not on the ballot for this November either. So hopefully it will be in the next few years, because the Arizona dual language education measure would repeal Prop 203. So if it does come on the ballot, please vote and repeal the English only, because as we've seen this whole presentation, like bilingualism culture, we need to think about all these things when we're assessing, when we're treating, but also the message that children are getting in the schools, that all languages are valued, all cultures are valued. And so this ballot, which hopefully will eventually come to be, it would have allowed school districts and charter schools to establish dual language immersion programs for both native and non-native English speakers. So hopefully someday, so we'll keep our eyes out for that. And so just to go over some of potential effects of these language policies, both in school and in society. So for students, that language attrition or language loss we talked about before is definitely a possibility. And I've seen it firsthand. I had a student that parents only spoke Spanish, siblings spoke Spanish, but schooling was English only. So by 3rd grade, he exited out of ELL. He no longer needed Spanish support, so he was in an English only classroom. And so that's when I started to treat him, and he had no more Spanish. He did not speak any, very, very minimal, a few words here, a few words there. And I remember thinking, how does this work? Because his parents, I've spoken to his parents, and they only speak Spanish. They speak very little English. So I imagine what their exchanges are at home, how their communication has been impacted now by the language attrition that their child is faced by being in an English only setting at school. So, and of course, there are other factors too. I think, you'll see sometimes with siblings, the siblings tend to speak to each other, or often speak to each other in English, which then, develops more of that, I guess, proficiency shift or the bilingualism shift. So it's not all or nothing, but I've seen that firsthand, that how language loss can occur. And also cultural identity impact, just that we talked about, language and identity, cultural identity are very much intertwined. So that what message are we giving children if we say, English only, English is the way to go, when we know that bilingualism is such a wonderful thing. And then academic achievement, there are quite a few documented disparities, educational disparities in language arts, math, reading, between ELLs and their monolingual peers, because English language learners, because they're being pulled out, they have limited access to grade level academic content. So there are achievement gaps. And then for adults in the workforce, thinking about job interviews or promotions, if someone has an accent, how is that viewed, or what biases might be there, or are they less likely to get a customer facing role in a company if they are a second language learner, things like that are kind of unofficial society language policies that there are these attitudes that exist. So to finish up, I know I've been going through a lot of information, and there are quite a few things to take in. But if I want you to take away something, it's these next two slides. So please, if you're tired, please stay with me for just a little bit longer. I want to debunk some myths. So you maybe have heard these, maybe you believe some of these are true, but that is not the case. They are not. So if a parent says this or thinks this, you can set them straight as the professional, as down the road, you can say, actually, no, that's a common myth. That's a misconception. So the first one is that bilingualism causes language delays. And I literally had that. I was seeing a client today, and the parents asked, like, oh, do you think that delayed his language because we put him in a bilingual program? No. So bilingual children are not more likely to be diagnosed with a language disorder than monolingual children. They're not more likely. It happens at the same, same percentage, same prevalence. And I like to think about, if I'm trying to explain this to a parent, I say, well, think about all the countries in the world. Think how many bilingual kids there are, how many trilingual, multilingual kids there are, and we don't see a huge increase in language delays. So, bilingualism itself does not cause language delay. So that's myth number one. Myth number two, speaking another language at home will confuse the child. That's the same thing with that client today. They were speaking another language at home. That is not the case. So young bilinguals can separate their languages. They understand that equivalent words in their different languages refer to the same thing. At 20 months old, they're able to differentiate that. And also, like we said before, code mixing or code switching, that's very normal, and it's not a sign that the child is confused. So that's myth number two. Myth number three, children with disabilities cannot become bilingual. That is a myth. That's not true. Studies have shown that bilingualism does not cause additional delays for children with existing disabilities. And research has shown no significant differences between bilingual and monolingual children with Down syndrome, autism spectrum disorder, and actually with speech and language impairment, bilinguals, in a recent study, bilinguals perform better than their monolingual peers. So that's a fun fact. And what we need to remember is that bilingual children need sufficient input in both languages to keep that bilingualism going. So that's myth number three. And number four, bilingual intervention education delay English development. This is not true. There is no evidence that bilingual intervention and education delay English development. And just in general, there's no evidence that just being bilingual is going to confuse or cause confusion for an adult or child. So the thing that someone needs to maintain bilingualism is enough input and opportunity to use both of their languages. So our final slide, why we study these topics of culture and bilingualism and all these different clinical issues. Why is this important? So it's essential we consider culture and bilingualism in the field. First, differential diagnosis, right? When we are assessing someone, we need to know if they're bilingual or multilingual, if they're from a multicultural community. We want to do our best to avoid over-identification or over-diagnosis. So we don't want to diagnose someone with a communication disorder who doesn't really have one. Think how awful that would be, especially in the schools when you are giving someone an individualized education plan or an IEP. That's usually for 3 years, that they're reevaluated every 3 years. So if you say this child has a disability, they're going to be on that track for 3 years, unless a reevaluation is requested. So, and it's also just a very large responsibility that you are saying that this child has a disability. You're giving that diagnosis. So we don't want to over-identify. And this is, like I've said, I've seen that happen in the real world. So a lot of graduate programs have multicultural tracks or just courses that talk about multicultural issues, which is really great for our profession to consider these things. And along the lines of differential diagnosis too, we talk about difference versus disorder, right? So just like we've seen, and we were talking about with bilingual eval, maybe the child has a lot of errors in English. They look like they have a disorder, but then when we evaluate their Spanish, totally typical, good to go. So clearly that's a difference. That's a language difference. They're still developing their English. It's not a disorder. So we can differentiate. We have a difference versus disorder. Whereas, oh, they're showing these difficulties in Spanish and in English. Okay, they have a disorder. They need services. So that's the differential diagnosis piece. These topics are also key for intervention design, thinking about what goals we're going to target. That's like we talked about with global language goals versus language specific goals, right? And appropriate goals. So thinking about, for a bilingual child, we write goals in English, Spanish, both, depending on the goals. What about an adult who has dysphagia and we need to recommend a certain diet? Their culture is going to come into play of what we should recommend. We should talk to family, which brings us to that next little bubble, family input, right? Family is huge. We're working with families and we need to value their input because they know the client best, they know the patient best. So these families, parents, siblings, they'll come to you with their concerns. And a lot of times a parent might say, oh, you know what, I'm worried they're getting confused. Maybe I should stop speaking Spanish or whatever language at home. And it's our job to say, hey, our job to dispel those myths and give them the information, the facts, and help them in any way they might need. And then lastly, service delivery, right? We need to think about these topics when we think about where we're giving services. In the home, is that most appropriate, or culturally, is that appropriate? Are we giving services only in English? Are we doing bilingual? Do we have a translator? Thinking about if you are a monolingual clinician, what's that going to look like? So these are all things we need to think about. So the main point is when you have a new patient or a student, we have to look at the whole picture, right? So, and that's always going to include whether they use one language or more than one language, and if they come from a different cultural background than you. And when that happens, it's your job to do an appropriate evaluation so you don't end up misdiagnosing someone, and your job to provide culturally competent services. And so even if you're not a bilingual provider, you will encounter bilingual and bicultural clients. And just from culturally diverse backgrounds. It's going to happen. I assure you. Our country is very diverse. Even if you're not, from Arizona, if you're from other states, all over, you will encounter a child or an adult from a different cultural background than you, or different, who speaks different language than you. So we need to know what to do when that happens. So I have just a few resources and books if you're interested in this topic and want to know more information. The books to the right are all by really great authors, all discussing bilingual language development, dual language learners, and cultural responsiveness and multicultural issues. Some are specific to speech language pathology, and then with resources and reading online, there's a great blog by Dr. Elizabeth Pena, who developed a really great bilingual assessment. Her blog is 2 Languages, 2 Worlds. The Leaders Project is another great resource. They have free assessment materials that are culturally inclusive, and they're out of Columbia University in New York. And then Bilinguistics is another great resource. It's a website made by bilingual SLPs. They have professional development seminar, like online webinars. They have books, some really great resources that have, I have a great book from them that goes into similarities and differences between English and Russian, English and Urdu, English and Arabic, all these different languages, because those are the things you're going to want to refer to when you need to know the similarities and differences. This is not a plug for them, by the way. Sorry, I've used I also use the handy Google to look up, you know, characteristics of different languages if you need. Sometimes you might have a very unique dialect. I had a girl who spoke a dialect of Guatemalan that I needed to just look up to see what I could find. Sorry, I'm getting on a tangent, but the point is there's a lot of resources out there if you are interested in learning more, and I'd be happy to talk to you more about them. So my email is there if you have any questions about this lecture or about just any of the topics we've talked about. I really appreciate your time, and thank you so much for listening to this lecture. Thank you again. Thank you, Dr. Patton, for the opportunity to present, and I hope you all have a great rest of your semester. Bye.